You're tuned into the deep dive, and today we're zeroing in on something you might be hearing more about, especially if you're in the UK. Hepatitis E, it might seem like a distant issue, maybe, but recent trends suggest it's actually, well, closer to home than you might think.
Exactly.
Yeah.
Yeah. Our goal in this deep dive is really to pull out the vital information about hepatitis C. Think of it as your rapid revision guide, hitting all the crucial points so you can understand it, remember it, and, well, feel confident about the key facts.
Right, we're going to unpack everything from what hepatitis E actually is, how you get it, all the way through to how doctors diagnose it and what the outcomes typically look like. And we'll try and throw in some memory tips along the way, too. Ready?
Let's do it.
Okay, let's begin with the definition then. What exactly is hepatitis E?
Okay, so hepatitis E is a viral infection. It primarily affects the liver, that's the main target.
Yeah.
The hepatitis E virus, or HEV, that's the culprit. And the main way it spreads is via the fecal-oral route.
Fecal-oral, right.
Yeah, essentially, when tiny amounts of infected sort of fecal matter get into your mouth, usually through contaminated water or food. The important thing to remember is that while it often causes, a sudden inflammation of the liver, acute hepatitis, it can become very serious,
Serious in what way?
particularly for pregnant women and also for people who already have existing liver issues. The risk is significantly higher for them.
Okay, so virus attacks the liver, contaminated water or food is the usual way in, and it's especially risky if you're pregnant or have pre-existing liver problems.
Got it.
Now let's look at the who behind the etiology. What kind of virus are we actually dealing with here?
Well, the cause is, as we said, the hepatitis E virus. It belongs to the Hepaviridae family. Now, for a key revision point, you need to know there are four main types or genotypes of HEV.
Four types. Okay.
Yeah. Genotypes 1 and 2, they're more commonly found in regions with, well, unfortunately, challenges in sanitation. Think of areas where access to clean water might be limited, that kind of thing.
Right, so more geographically specific in those cases. What about the other two? What distinguishes them?
Well, genotypes 3 and 4, they have a much broader global reach. And this is where it becomes really relevant for us here in the UK. These genotypes have zoonotic links,
Zoonotic, meaning?
meaning they can jump from animals to humans. And the key animals to remember here are pigs and deer.
Pigs and deer. Okay, that's a crucial link, isn't it? Especially when you think about our diets and, well, potential exposure. Speaking of who's at risk, let's break down those risk factors. Who should be particularly aware of hepatitis E?
The main risk factors, they connect directly to how the virus spreads, really. Firstly, if you're living in or traveling to areas with poor sanitation, your risk naturally increases. Secondly, consuming contaminated water or food, that's a major pathway for infection. And a specific food item to keep in mind is undercooked or raw shellfish.
Ah, shellfish. Right, another important one to note down.
Exactly. And then, for those genotypes 3 and 4 we mentioned, direct contact with infected animals or their products is a risk. So handling raw pork, for example. And finally, and this is really critical for revision, pregnant women and individuals with pre-existing liver disease are at a significantly higher risk, not just of getting it, but of developing severe illness if they do get hepatitis C.
Okay, so quick summary for the mental checklist then. Poor sanitation areas, contaminated food and water, especially shellfish, contact with pigs or deer products, and being pregnant or having liver problems significantly elevates your risk of a severe outcome.
Got it. Now, how does this virus actually do the damage? How does it cause the liver to become inflamed? Let's explore the pathophysiology.
Okay, so the process starts when HEV gets into the body,
Yeah.
usually through that contaminated food or water we talked about. Its primary target is the liver, specifically the liver cells, which are called hepatocytes.
Hepatocytes, right. Once it's inside those cells, the virus starts to multiply, it replicates. And it's this viral replication that really triggers the inflammation and the damage to the liver tissue. Our immune system also obviously kicks in to fight the infection, but sometimes this immune response itself can actually contribute to the liver damage.
So the body fighting back can cause problems too.
In some cases, yes. And there's also ongoing research looking at whether some of the virus's own proteins might directly harm the liver cells as well. So you can think of it as, well, the virus setting up shop and our body's reaction both causing trouble in the liver.
So it's like a two-pronged attack on the liver, the virus itself, and our body's defense. Makes sense. Now, if someone comes in with signs of liver problems, how do doctors figure out if it's hepatitis E versus something else? Let's talk about the differential diagnosis.
Yeah, that's a really important step, obviously. When a patient presents with symptoms suggesting acute viral hepatitis, hepatitis E is definitely one of the possibilities we need to consider. The other main viral suspects are, the usual ones, hepatitis A, B, C, and D. So those will always be on the list to rule out.
Okay, the other main hepatitis viruses.
Exactly, but it's not just other viruses you need to think about. We also need to consider non-viral causes of liver inflammation. Things like autoimmune hepatitis, for instance, where the body's immune system mistakenly attacks its own liver. Or drug-induced hepatitis. Certain medications can cause liver inflammation as a side effect. And, of course, alcoholic hepatitis resulting from excessive alcohol use. So, yeah, quite a range of possibilities that can look similar initially.
A broad spectrum, then, highlights the need for really accurate diagnosis. Before we get to how that's done, let's look at who's getting hepatitis E, particularly here in the UK. What's the epidemiology telling us?
Yeah, this is where hepatitis E's sort of increasing relevance in the UK really comes into focus. As we touched on earlier, the large majority of cases reported here are actually due to genotypes 3 and 4.
The ones linked to animals.
Precisely. And the key link is that zoonotic transmission. Specifically, it seems to be through eating undercooked or raw pork or deer meat. It's a pretty direct connection to our food chain.
Wow, okay.
And while the overall number, the incidence is still considered relatively low compared to some other things, there's a strong suspicion among experts that it might be underdiagnosed.
Why is that?
Well, it could be because the symptoms can sometimes be quite mild or even absent, or they might be mistaken for, say, the flu or another illness. So the true picture, the actual number of infections, might be larger than the current statistics suggest.
Undercooked pork and deer, that's a really specific point for our UK listeners to remember. So how would someone even suspect they might have hepatitis E? What are the typical clinical features, the signs and symptoms?
Well, the way hepatitis E presents often mirrors other acute viral hepatitis infections. There's quite a bit of overlap. Symptoms can really vary quite a bit from, no symptoms at all, what we call asymptomatic or very mild, non-specific symptoms, right up to quite severe illness.
Okay. But what are the common ones to look out for?
The common signs, if they do appear, include things like jaundice, that's the yellowing of the skin and the whites of the eyes.
Yeah.
Also fatigue, just feeling really wiped out. Abdominal pain, often in the upper right side where the liver is. Loss of appetite. Dark urine, and pale stools. Think of these as the sort of classic indicators of liver inflammation, really.
Right. Those sound like fairly recognizable signs of liver issues in general. What about those specific risks for pregnant women we talked about earlier? How does it present differently for them?
Yeah, this is critical. In pregnant women, hepatitis E carries a significantly higher risk of something called fulminant hepatitis. Yeah, it's a very rapid and severe form of liver failure. It happens quickly and it's extremely serious. And tragically, this can lead to a high risk of both maternal complications, even death, and complications for the fetus as well. This is a really, really important point to remember regarding the potential severity of hepatitis E in this specific group.
Absolutely. A critical point to recall for exams and practice. So if someone presents with these kinds of symptoms, what steps do doctors take to actually confirm if it is hepatitis E? Let's delve into investigations.
Okay, the diagnostic process involves several key investigations, usually blood tests. First, there's serologic testing. This looks for HEV-specific antibodies in the blood, specifically IgM and IgG antibodies.
IgM and IgG. How do you remember which is which?
A simple way is IgM indicates a more recent active infection, think M for me now, or minute. IgG suggests a past infection or perhaps immunity, think G for gone or got over it.
M for me now, G for gone.
Yeah.
Okay, that helps.
Then we have HEV RNA testing. This test directly detects the virus's genetic material, its RNA, in the blood. This provides the most definitive confirmation of an active infection.
So that confirms the virus is actually there and replicating.
Exactly. And alongside these virus-specific tests, liver function tests, or LFTs, are crucial. These are standard blood tests measuring various liver enzymes and proteins like ALT, AST, bilirubin. They give us an idea of how well the liver is working and the extent of any damage. And finally, in some cases, particularly if things are unclear, liver imaging like an ultrasound or maybe an MRI might be used. This gives a visual assessment of the liver structure and can help rule out other potential problems like gallstones or tumors.
Right, so combination of blood tests looking for the virus itself, antibodies to it, its effects on the liver via LFTs, and sometimes imaging for a visual check.
Yeah.
Once a diagnosis of hepatitis E is made, what's the usual approach to management, especially here in the UK?
Well, in the UK, the good news is that for most people, cases of hepatitis E are self-limiting.
Meaning they just get better on their own.
Yeah, essentially. The body's immune system usually clears the infection without specific treatment. So management primarily focuses on alleviating symptoms and providing supportive care. This mainly means things like getting plenty of rest, staying well hydrated, and eating a balanced diet to support liver function and recovery. Avoiding alcohol is also really important.
Okay, so rest, fluids, good food, no booze. What about hospital?
Hospitalization is typically reserved for the more severe cases, or if there are complications, or if the person is in one of those high-risk groups like pregnancy where closer monitoring is definitely needed. Now, while there isn't a specific antiviral drug that's routinely used for most hepatitis E cases, a medication called ribavirin might be considered in certain specific situations.
Like what sort of situations?
Often in immunocompromised patients who might develop chronic infection or potentially in very severe acute cases, but usually that's under the guidance of a specialist hepatologist. It's not standard for everyone. But really, the cornerstone of long-term management is actually prevention.
Right, stopping it happening in the first place.
Exactly. Ensuring safe food and water sources, practicing good personal hygiene, like hand washing, and particularly relevant for the UK, being cautious about consuming undercooked or raw pork and deer meat. Cooking pork thoroughly is key.
Okay, so mostly supporting the body's natural recovery process and a big focus on prevention, especially around food hygiene with pork and deer. What's the overall outlook then for someone who contracts hepatitis E? What's the general prognosis?
Generally, the prognosis for hepatitis E is quite good. Most healthy individuals make a full recovery within, say, a few weeks to a couple of months, and usually without any lasting liver damage.
That's reassuring for most people.
It is. However, and we keep coming back to this because it's important, you have to remember those higher risk groups we've discussed, pregnant women, and people with underlying chronic liver disease. For them, the prognosis is more guarded. They face a much greater chance of developing severe hepatitis and potentially serious complications. And while it's rare overall, that complication of fulminant hepatitis, the rapid liver failure, is very serious and can be life-threatening. So yes, good overall, but with really important exceptions to be aware of.
Okay, so generally a positive outcome for most, but definitely significant risks for specific populations. Finally, let's just touch specifically on those potential complications of hepatitis E again. What are the main serious issues that can arise?
Well, as we just mentioned, fulminant hepatitis leading to acute liver failure is probably the most feared acute complication, though thankfully rare in healthy individuals. We also absolutely need to re-emphasize the severe risks for pregnant women. These can sadly include both maternal mortality and adverse outcomes for the baby, like miscarriage or stillbirth.
Gosh, really serious then.
Yes. And then there's the issue of chronic hepatitis E. This isn't usually seen in people with normal immune systems, but in individuals who are immunocompromised, perhaps due to an organ transplant and the drugs they take, or certain chronic conditions like HIV, the virus can sometimes fail to clear and persist for longer than 6 months, becoming chronic. Chronic HEV can then lead to progressive liver damage, cirrhosis over time. So these complications really highlight why close monitoring and appropriate management are so important to try and prevent them or address them quickly if they do occur.
Okay, so let's quickly recap our deep dive into hepatitis E for revision. Key points. It's a viral liver infection, HEV, mainly spread enterically. That's the fecal-oral route, contaminated food and water. But remember, in the UK, genotypes 3 and 4 are common, linked specifically to undercooked pork and deer meat.
And remember, the E in HEV can stand for enteric transmission, but also think especially risky for pregnant women and those with existing liver problems. It can be very severe in those groups.
Good mnemonic. Diagnosis involves serology, IgM, IgG, and HEV RNA tests, plus LFTs. Management is mostly supportive care, as it's often self-limiting.
That's right. Rest, fluids, nutrition. Ribavirin is reserved for specific cases. Prevention is key: food safety, hygiene.
Prognosis generally good, but watch out for fulminant hepatitis, especially in pregnancy, and chronic HEV in the immunocompromised.
Precisely. And hopefully breaking it down like this, section by section, has given you a clearer roadmap for understanding hepatitis E and, crucially, remembering those key facts for your revision.
Absolutely. And a final thought for you listening. Consider those public health implications, especially around food safety and potential underdiagnosis here in the UK. And if you are revising for the MSRA, don't forget to check out passthemsra.com and also freemsra.com for loads more high-yield resources. You'll find practice questions, detailed notes, everything you need.
Definitely worth a look.
Thanks for taking this deep dive into hepatitis E with us today.
Yep, thanks for listening. Until our next exploration.